Hi friends, welcome to Nurses Corner. Today I'm going to discuss some questions of NMC CBT examination. First question: which of the following actions jeopardize the professional boundaries between patient and nurse? In this question, we need to consider few key points, that is jeopardize the professional boundaries and between the patient and nurse. In this choice, we can see that focusing on social relationship outside working environment, that will be the correct answer. But while we consider other choices, we can see that focusing on needs of patient related to illness, focusing on withholding value opinions related to the decision, these two choices are inside and that is related to the patient care. So the first choice is outside the care, so that will be the answer, focusing on social relationship outside working environment. So in this way we can, if we are difficult to find out the right answer, we can eliminate the choices and we can identify the right answer. So we'll move to the next question. An elderly client with dementia is cared by his daughter. The daughter locks him in a room to keep him safe when she goes out to work and not considering any other option. As a nurse, what is your action? So this question is related to safeguarding issues. So in the choices, explain this is a restraint, urgently call for a safeguarding, and arrange a multidisciplinary team conference. That will be the right answer. Then the other choices are do nothing, as this is the best way of keeping him safe. As a nurse, we are responsible for the patient, so that's why we can eliminate this one. And call police social service to remove client immediately and refer to safeguarding. So before we call the police, we can do explain to the daughter this is non-restraint, so we can explain like that. And fourth choice is explain this is a restraint and discuss other possible option, so that is also a wrong option. So the first option is explain this is a restraint, urgently call for a safeguarding, and arrange a multidisciplinary team conference. Next question is an elderly client tells you that the carer is using his money when going for shopping and not buying him any food. The client appears malnourished and weighing only 35 kilograms. As a newly qualified nurse, what is your action? So we need to consider a few things in this question. First is an elderly client, and second is and the carer is not buying any food, and the client appearance, that is malnourished and weighing only 35 kilogram. And the other point is, as a newly qualified nurse, if we are a newly qualified nurse, we can listen to the client and escalate to the line manager. Fifth question is, a Chinese woman has been admitted with fracture of wrist. When you are helping her undress, you notice some bruises on her back and abdomen of different ages. You want to talk to her, and what is your action? First choice is ask her husband about the bruises, ask her son or daughter to translate. And third option is arrange for interpreter to ask questions in private. And fourth is do not carry any assessment and document. This is not possible as the client cannot speak English. The answer is arrange for interpreter to ask questions in private, because if the patient is not English speaker, we need to ask for an interpreter, because we can't consider the family members, or we can't consider do not carry any assessment. That's why we need to arrange for an interpreter to ask questions in private. We can arrange with our manager. Seventh question is, a new RN have problems with making assumptions. Which part of the code she should focus to deliver fundamentals of care effectively? In this question, we need to consider a new RN and have problems with making assumption. The choices are prioritize people, practice effectively, preserve safety, promote professionalism and trust. For making assumptions, we need to always prioritize people. That will be the answer, prioritize people. Next question is risk for health issues in a person with mental health issues. So that is always risk is same in people with and without mental illness. That is the answer. So the choices are increased than in normal people, slightly decreased than in normal people, and very low as compared to normal people. These three choices are wrong. So that is even it with and without mental illness, the risk is always same. So that is the eighth question. Ninth question is what is the use of protected meal time? Patient get protection from visitors. Staff get enough time to have their bank to give personal hygiene to patients who are confused. Patient get enough time to eat food without distraction while staff is there. So that is the answer. Always patient get enough time to eat food without distraction while staff focus on people who needs help with eating. In all NHS, I have a special time for for the meal time, and the visitors are not allowed in that time. So that is the answer. Patient get enough time to eat food without distraction while staff focus on people who needs help with the eating. So we can easily eliminate that other option. Patient get protection from visitors. Patient get enough time to have their bank and to give personal hygiene to patients who are confused. That the three choices we can easily eliminate. Then the question is food rich in antioxidant. That is very only one choice: tomato, broccoli, and carrot. So the other question 11th question is prions are present in, so that is prions are present in CDJ, that is Creutzfeldt-Jakob disease. That is disease that will affect the brain. So that is the characteristic, prions are present in CDJ. So that answer is direct. So we can easily check that answer in CDJ. About CDJ we can easily check in Google. And we can move to 12th question. A slow and progressive disease with no definite cure, only symptomatic management. A slow and progressive disease with no definite cure, only symptomatic management. So on the 13th question, an infectious patient is kept in isolation and are advised to take standard precaution. How maintained? Choices are waste bin, hand rub, gloves, gown and mask available in room, information leaflet attached on door, gloves, gown and mask given to the patient, gloves, gown and mask placed inside the room, and waste disposal facilitated are kept outside. Waste disposal facility arranged inside room, gloves, mask, apron and hand rub arranged on a trolley outside room next to door. So the 13th question is an infectious patient is kept in isolation and are advised to take standard precaution. How maintained? So the answer is waste disposal arranged inside room, gloves, mask, apron and hand rub arranged on a trolley outside room next to door. That will be the answer. So in this that is wrongly written, so we need to consider that answer. 14th is how can a patient involved in patient-centered care? Assessing patient healthcare needs with the other members of the healthcare team, engaging patient in conversation, assessing and identifying needs by involving client, focusing on preferences and formulating plan accordingly. And third choice, engaging patient in discussion and focusing care based on his medical condition. So the answer is engaging patient in conversation, assessing and identifying needs by involving client, focusing on preferences and formulating plan accordingly. So it's very easy. How can a patient involved in patient-centered care? So we can go through three options and we can easily identify the right answer. Engaging patient in conversation, assessing and identifying needs by involving client, focusing on preferences. 15th question is you are mentoring a third year student nurse. The student requests that she wants to assist a procedure with the tissue viability nurse. How can you deal with this situation? Tell her it is not possible. Tell her it is possible if you provide direct supervision. Call to the college and ask whether it is possible for a third student to assist the procedure. Allow her as this is the part of her learning. Tell her it is possible if you provide direct supervision. You are mentoring because we are the mentor and mentoring a third year student. The student requests that she want to assist a procedure with tissue viability nurse. How can deal with this situation? If we are a mentor, we need to assess with our direct supervision. That will be the answer. And 16th question is, which drug can be given via NG tube? Modified release hypertensive drugs, crushing the tablet, lactose syrup, insulin. So we can easily delete some options. Insulin, and we don't know lactose syrup we are giving through NG tube. So if that drug is allowed to give through NG tube, we can, because we don't know, because some drugs will always, we can, if we can, some drugs are always allowed to crush. That drugs always we can give to NG tube, with the NG tube. So the answer is crushing the tablets. We don't know modified release hypertensive can crush and give, so we will not select that option. We will select crushing the tablets. Will give via NG tube. Why constipation occurs in 17th question is, why constipation occurs in old age? Anorexia and weight loss, decreased muscle tone and peristalsis, increased mobility, increased absorption in colon. So the answer is decreased muscle tone and peristalsis. That will be the answer, because other three choices are not relevant. We can eliminate anorexia and weight loss, and increased mobility, because most of the old age are not decreased mobility and increased absorption in colon. We can eliminate these three: increased absorption in colon, increased mobility, and anorexia and weight loss. So we will consider, we will select that option, decreased muscle tone and peristalsis. That will be the answer for 17th question.